Hi, I'm Rebecca, and this is an introduction to ocular surface pain from the patient's perspective. So first of all, what is ocular surface pain? What's it like? How does it feel?
I would describe it as a feeling like when you get shampoo in your eye. Something that everybody's familiar with. Except for most people, when you get shampoo in your eye, your eyes water a little bit, they sting for a few minutes, and then it all goes away. You can go about your day. But for me, it feels like that all day long, every day. I also have neuropathy in one eye, and that feels more like a stabbing pain, like a hot stabbing pain behind my eye. And it's a hard pain to describe because it's nothing I've ever felt before. But that's my sort of unique pain sensation.
Ocular surface pain for me is like raw, exposed nerve endings with a constant burning pain and foreign body sensation. And when it's at its worst, I also have piercing, stabbing, almost electric shock-like pain that just shoots through my entire eyeballs. And it's quite dreadful.
The pain is unreal. It's undescribable. It's so bad you just can't, and sometimes it'll last for weeks. You just can't stop it.
How does ocular surface pain affect our daily lives?
I said I'm feeling 8 out of 10 pain in my eyes, such that it is getting in the way of my ability to work. It's getting in the way of my ability to live my life. And I can't think of anything else when I'm in this much pain.
The dry eye set in. That was terrifying because that made my life very small very quickly. I had a very good, very demanding full-time job that involved a lot of computer work, became much harder to do.
It's important to understand that all this is the result, not the cause of our pain symptoms. Our mental health takes huge hits from these levels of pain. The problem is not our personality type. The problem is the pain. As you might imagine, pain is pretty motivating. We'll do anything to get our pain down to a manageable level. We've tried all of the over-the-counter everything. We've tried all of the prescription meds for dry eye and anything remotely related to it, because most of us do have some form of ocular surface disease. All of the MGD home remedies, all the unreimbursable in-office interventions, pros, scleral lenses, I'm wearing mine right now. We've tried all the systemic medications, the gabapentins and what have you, and an awful lot of experimental pain treatments to boot. Then there's dietary change, alternative medicine, and a host of lifestyle strategies, not to mention the antidepressants, anti-anxiety meds, and frequent therapy. So that's a lot of treatments. But what did it take before we could even get access to the treatments?
It's been a journey through 3 years and 10 doctors to find an ophthalmologist who would really listen to what I was describing in terms of sensations in my eyes and to help me find a treatment plan.
I've probably seen over 15 different optometrists and ophthalmologists across like 4 or 5 different states over the years.
People sometimes said, well, what doctor have you seen? And I'll say, well, all of them.
What do we need from you, from ophthalmology, from the experts that we are looking to for help?
I would definitely recommend that ophthalmologists start to consistently use the pain scale in the office setting and really help educate patients on how to use that to communicate what they're feeling.
When you're in pain, you make dumb decisions. You make poorly informed decisions because all you're thinking of is, how can I stop this? This would have stopped the skid enough. If I had just put these on 10 years earlier than I did, I would have been a much happier, more well-adjusted person.
I would just encourage ophthalmologists to get together with their colleagues who do pain management and who specialize in pain, and figure out ways to partner.
We're diverse. Some of us have generally healthy eyes. Others have great gobs of ocular surface disease going on. Some of us are very healthy in general. Some of us are struggling with systemic diseases. But what we have in common is that our eye pain is off the charts. We are struggling specifically with the lack of expert care for this. We need ocular surface pain to be named and known and identified and diagnosed and quantified and understood. And boy, do we ever need some solutions. But most of all, we need to know that you are there for us. We need you to engage with our pain. Thank you.